Well, TRIVALVE is a large registry, a multi-device registry on tricuspid regurgitation. There are many different devices being tested currently, off-label or within studies to test if tricuspid regurgitation can be treated and which is the effect then on the patient. And TRIVALVE is just combining all the different results. Well, in TRIVALVE is a registry study with about 15 or 16 sites worldwide. And the study I'm presenting today is a study which is focused on the edge-to-edge valve repair technique. So using the mitral clip, which has been designed for the mitral space, now it has been used also in the tricuspid valve. And we're presenting data from about 249 patients which have been treated offline, off-label or in compassionate use programs with a mitral clip. Well, the first thing what we found is that these procedures can be done very safely. We have to know that the operative risk in patients with tricuspid regurgitation is very high. And the mitral clip is a very safe device for the mitral regurgitation, but also if you use this in the tricuspid regurgitation, the 30-day mortality rate was very low, somewhere between 2 and 3%. Despite this, we're very frail and sick patients. Well, first we would need to identify the right patients which is profiting from such a therapy. And these are usually some more elderly patients, female patients with atrial fibrillation who have some significant tricuspid regurgitation. Those have swollen legs, edema, shortness of breath, and fatigue. And if you treat those patients with a device such as the mitral clip, then you do see that the patients have a significant improvement. At least this is what we were able to demonstrate in our registry, that around the majority of patients were in New York Heart Class 3 or 4 before the procedure, and at 1 year follow-up, we were able to reduce the significantly. At 1 year, 66% of patients were in New York Heart Class 1 or 2. So there was a significant improvement, also a significant improvement in terms of their edema. The rate of edema was significantly reduced from 85% to, let's say, 24% in that range. Yes, there are. Well, we looked first at how effectively we can reduce the TR, and if you use the TR grade of 2+ or less as the procedural outcome parameter, then we were able to achieve this in about 77% of patients, and this reduction was also very durable over the 1 year course. At 1 year echocardiographic follow-up, there were still 72% having a TR 2+ or 1+.